Hi, I'm Dr. Parekh from Austin Family Allergy and Asthma, and today I want to talk about something that is so critical to allergies and asthma. And I'll tell you, 90% of the people I meet for the first time, they do not know how to do it, which is how to properly inhale your nasal spray or your asthma medication. And if you're not doing it correctly, then guess what? The medicine is not getting adequately delivered and your symptoms are still going to be out of control. So this is always one of the first things I try to teach all of my patients. So we're going to start with that in mind with the nose. So if you haven't used your nasal spray in a while, what you want to do is shake it up and hear that mist go in the air. And then after you've cleaned out your nose or you've done a neti pot or a saline irrigation, you want to tilt your head down and then put it going towards the outside is the key. And then just a gentle sniff like that and hold for a few seconds. What you don't want to do, which I see people doing all the time, is they put it in the middle up their nose and then they breathe it back all the way, and it causes irritation and sometimes even a little bleeding. So again, the right way to do it is going towards the outside, head down, spray, gentle sniff. You can even squeeze it for a few seconds. You don't want it to come out the front and you don't want to feel it in the back of your throat. Otherwise, that's the wrong way to do it. Next step, we're going to move down to the lungs. One of the most common prescribed medications is an Albuterol Inhaler or any of your steroid inhalers. So if you haven't used them in a while, again, in general, shake them up. And then what you will do is you will attach it to your spacer device. For me, this is critical to get the medicine across. It will go in here, and then you will breathe it in, and you want to do a deep, slow breath. So you attach it to your mouth, press it in, it goes in here, and then you go deep, slow breath, hold it for 10-15 seconds, and then breathe out. Wait 1 minute, and then repeat. That's the correct way to do it. Now, another class of medication you might get, that's called a meter dose inhaler, you might get from your doctor, is a dry powder inhaler, which is different. It's a dry powder. So what you want to do is open it up, shake it up if you haven't used it, prime it, and then hold 10-15 seconds, breathe out slowly. Fundamental difference, this is a rapid breath instead of a deep, slow breath, and that way it's related to the drug and how it's delivered and deposited in your lungs. Regardless, if you're not sure, review the technique with your doctor, but you got to do it with the right technique, otherwise the medicine is just not going to work as effectively as it can be. So I hope you find this useful.